When you begin to help a woman, you end up helping an entire family and you end up helping a whole nation and society. Beacon of Hope began in the year 2002, and it was primarily out of a dream and a vision that God put upon my heart.
When Beacon began, the HIV and AIDS situation was very intense. Out of a group of 118 people would be HIV positive. They do not have information on what is HIV and AIDS. How can I actually live with it much more positively? How can I accept it?
I felt really led to be involved in that because there was a lot of stigma and discrimination where HIV positive people were concerned. Most of those infected were women, but it was not really the women who were educated. It was women who didn't have economic opportunities. It was women who didn't have a voice.
Trying to bring in hope in a situation whereby there was limited information, limited access to medication, and also limited access to economic opportunities.
So that's how we began our economic empowerment program. We had a weaving program, we had a sewing program, we had a little room which acted as a counseling and testing as well as a medical center. We couldn't just address one problem. We can't help economically and health-wise without helping the children.
We don't look at the individual in just one aspect.
The only way we could best provide is to make ourselves a one-stop shop. We tailored our mission on that, to bring hope to women infected or affected by HIV and AIDS by equipping them and empowering them to be able to meet their physical, their spiritual, their economic and social needs. Our focus is healthcare, giving holistic health services for those infected with HIV and AIDS.
They'll come in for counseling and testing to find out whether they're HIV positive. If they're HIV positive, we have the prevention of mother-to-child services, working with the mother to remain healthy and also to be able to continue living positively.
We have outreach services. We know that many people miss the opportunity to get tested. As opposed to waiting for them to come to us, we actually go to them.
And then we have primary health care, where someone walks in and they're able to access medical care as they need.
What motivates us is just to be able to see the immediate outcome when we offer the services to these clients.
That technical training that we started has evolved now into a college, but we've diversified the courses that we are providing based on the needs of the women and the community.
They have seen people who have come, who are very frustrated in life. Those people who see like they have come to their end. They come to a point and starting and working with the skills that we offer, that they are employing even others and bringing hope even to other people in the community.
The other services that we offer here are what we call psychosocial support groups. These are basically meant for people living with HIV and AIDS to be able to share their experiences.
Some of these children and families that we are working with had no hope. So what we do is that we talk to them, we counsel them.
That's how Beacon comes in, to tell them that all is not lost. The school that we have now, it's began as a need among the women. They had young children and the children needed to learn how to read and write.
I see that as a prevention model as well, because as you work with the younger children, we teach them about HIV and AIDS, we teach about behavior change, we teach on character formation. When they come to Beacon, we are able to shift their thinking.
At the moment, we have enrolled the primary level from class 1 to class 2. 50% of the children in the school come from the economically stable families, those who are able to partner with Beacon by paying school fees. Then 50% of the children come from the vulnerable families. We work with them, we walk with them, we counsel them, we nurture them to make sure that they are empowered and they are taking up their responsibilities as parents to stand now on their own. In everything that we do in Beacon of Hope Academy is geared towards holistic development of the child. When we are brought a 3-year-old baby, if we walk with them all the way, what kind of men and women will we be giving back to the community?
The bulk of the Kenyan populations are youth. So it's a category of people that we cannot ignore.
We target youth specifically with sexual and reproductive health messages.
so that we can begin to prevent the next generation from becoming HIV positive.
Some of them didn't have a background in arts, but we've been able to get them from where they do not even understand that they have talents to a point where their talent is so developed that they can actually benefit from the creative economy.
God brings to us very broken lives, people who've given up on life, but as we give them healthcare, giving education to their children, giving economic opportunities for them, as we work alongside them, they begin to receive hope.